Well, joining me now is Sangeeta Reddy, Joint Managing Director for Apollo Hospitals, the largest private chain of hospitals in India. Sangeeta Reddy, we've seen from all across hospitals are actually reaching out to NDTV. They're going on Twitter to try to get their appeal heard for oxygen, that states are blocking it. How has it come to this, and what do you think is really needed desperately now? We know the Prime Minister chaired a meeting. There's again a meeting with oxygen manufacturers tomorrow. What are the SOS measures we need to take now to make sure this doesn't happen?
So, Sonia, I think this is a significant and a serious situation which is facing the whole country, and hospital operators across the country are extremely desperate. But of course, in 5 or 7 states, the situation is worse than in the rest of the country. So this morning we had a critical situation in our hospital in Delhi. And so I tweeted, of course, but I also reached out and, I'm happy to say that from multiple counts, we did get a response. Whether it was the Haryana police, the joint managing director of Inox, who is our supplier, said that his truck was not able to move. And what happened immediately or very shortly after that was not only was the truck allowed to move, but we saw that even from the previous night, Delhi government had been working. But also the FICCI president reached out to the Home Minister. Right. And Home Minister has issued an order today saying that there should be allowed free access and free movement of oxygen tankers. So let me explain this for a minute. See, basically, India produces more medical grade oxygen than we need. And that is a significant data point. Almost a week ago, Shri Piyush Goyal chaired a meeting where he requested all industry grade oxygen to be diverted to medical oxygen, which is actually what Kerala started doing almost 1.5 months ago. Right. The critical shortage today, because you asked me what do we need to do, the critical shortage today is not really oxygen, but the tankers and the cylinders which transport the oxygen from the generation point to the hospitals where they are needed. So one of the immediate and critical things is to enhance the effectiveness of the delivery system. So the tankers that are moving up and down should not be stopped and blocked at borders. Absolutely. So that is why my tweet said, please treat an oxygen tanker like an ambulance and give it a clear path that will increase its effectiveness. So point number 1 is that.
I think that's very important because it's like almost like an organ transplant, like the green corridor should be given with that level of urgency.
You're absolutely right, Sonia. So that is the need right now. So we enhance effectiveness of the oxygen we have in the cylinders we have. In parallel, we have to make more tankers and cylinders. That is a critical need as well, because this kind of situation is probably going to sustain for another month, if not longer. So we must gear up by having more tankers and more cylinders. The next thing which we ourselves as hospitals, like we did this in Apollo, is to enhance the productivity of the oxygen that we have. So look at efficiency measures in oxygen. Number 1, check all leakages. This is a safety factor. So all our quality teams have done that. Also, the criteria for giving of oxygen, make sure that patients who have a saturation only below 93 or 94, you start oxygen and start with only 2 liters. So the protocols can be slightly modified, but also ensure that you're proning the patient so that you get higher effectiveness. Now we're sharing these protocols with nursing homes and hospitals, and most people are following this.
No, these are very important points. I'm seeing it going all around really about proning and the use of it and this rationalizing. But, that's happening at Apollo, which still has the resources, the large scale across the country. But the worry is that what's happening in these small nursing homes and hospitals. You saw just now that CEO breakdown. And even from Apollo and hospitals like Max, our top private hospital chains, we got SOS messages saying there's a few hours left. What is it like for doctors? What is the administration actually going through when you're running out of oxygen or a tanker stuck in Haryana? And remember, Haryana feels they need the oxygen too. How do you decide where that tanker has to go? What is it like for you, Sangeeta Reddy, and for doctors and nurses who actually have to speak to those patients and their families? We saw the Nashik tragedy yesterday as well. It's heartbreaking.
So Sonia, it's an unbelievable tension, and basically what we are trying to do is shield our patients, our staff and the public from this. and we are absorbing. So our CEOs, everybody is in the act. Our CEO most of them were up till 2 in the morning making sure that their supplies are in place, because we don't want patients worrying about oxygen. That is our responsibility. And when we cannot handle it ourselves, we look up to the government. And I must say that the Home Minister, everybody has been very supportive and very helpful. They've understood the need. As you know, Prime Minister is also having a meeting about this. Health Ministry reached out about ensuring that the efficiency usage protocol is shared with all nursing homes.
Absolutely.
This discussion is happening from the Health Ministry. So I think everybody is working together.
Let's
make sure that nobody is hoarding oxygen, and that we can make sure that it reaches the people who really need it.
Absolutely. It's a national emergency, Sangeeta Reddy, the Supreme Court said. We all have to come together to fight this together. That's the need of the hour. Thank you, Sangeeta Reddy.